Game of Thrones, you know? Anyway, again, I apologize. I didn't do this. Okay, but they've cut open the aortic arch. Somebody, I guess they thought the red was where they were going to. Okay, but it's there's the actual vessel with the red inside of it. Okay, they've cut it open. Just see what you're going to. Now, all this stuff that was here, the thymus gland, you can get rid of. Okay, just take that right off, and then just use your dull probe and just let's see if I can find one that's not done. Excuse me. All you're going to be doing is just like take the contactive tissue and just strip it back. Follow the vein or the artery where it's going. Okay, so you just push this around to get that to happen. All right, so coming off the aortic arch, that's the aortic arch right here. It turns underneath and becomes the thoracic aorta. As it goes through the diaphragm, becomes the abdominal aorta. Okay. You have your intercostal arteries and veins right here along the ribs. Okay. Then we come up to the branches. The cat only has two. Okay, there's the vagus nerve right there. So we have the brachiocephalic and the left subclavian. Now again, left or right doesn't usually count unless there's a difference. Like this one's, so as I said, the left subclavian as opposed to the right subclavian, which is going to be over here. Okay. So again, the left subclavian. Then we're going to follow the branches of the left subclavian. And I think now I have to check your list. I'm going to say these vessels. I'm not sure that all of these are on there. Okay. But you see, there's three right here. Okay, that went down. And if you follow along here, you see there's one that takes a big dive, one that stays more on the surface, but they kind of go down and underneath. And then this one travels underneath here, going along underneath the vein, and then finally turns down to the outside. Okay, so I'm not sure that these two are on yours. Okay, there's the costal cervical and the vertebral. So costal cervical, vertebral, and then the transverse scapular. Okay, I'm sorry, it starts off as the thyral cervical, okay, and then turns into the transverse scapular when it turns again. Okay, again, that's going to follow underneath the jugulars that you see right there. Then the subclavian leaves the body wall, so out here where it's in the axilla, it's the axillary artery. When it comes out here to the brachium, it's the brachial artery. It's just changing names as you go to different locations. Okay. The branches that we have out here, we have one that dives deep, and it should be this one right here, along with the vein going with it right here. That's the subclavian. Subscapular. Okay, the subscapular right there is the only branch we're doing off of that. I think that's in your book. Okay. And now coming back over here to the rest of the arch, let's see if I can pull these back so you can see it. Do you see that there's three branches right there of the arteries? So you have the right subclavian and then the right and left common carotid, which go up along the neck. Okay. Now the cat and the human up top here would split into internal and external carotids, but the cat doesn't have an internal carotid. It fills in with the connective tissue. Okay. So we usually don't go up any higher than this. Just say carotid and that's it. Okay, common carotid. Again, the vagus nerve is right along with the carotid. We've done that before, but I'm not sure she might put it on again because it's listed here too. Okay. And that's pretty much it for the arteries above the heart. Vein-wise, again, I'm going to tip the heart and the lungs over a little bit. You can see this, the superior vena cava coming up, and you see this vein that loops around like a parallel to the aorta. It also begins with an A, so that's the azygos. That's the one that people always forget about. Okay, it's the first vein of the superior vena cava. After that, you can lay it back down. Superior vena cava branches into the brachiocephalix. Then it has a little tiny subclavian, and then becomes the, again, this one's broken. This one should go up here. There's the axillary. There's the subscapular, and then again the brachial. Okay. Again, they change names based upon where they're at. This cat is a mess. Okay. He's got his external jugular running to the outside. His internal jugular is this little tiny thread of a vein right here running alongside the carotid. Okay. Your cat may or may not have a visible one. Okay, you see how tiny it is. Humans are exactly the opposite of this. Okay, humans have a huge internal jugular, a little tiny external. Okay. And again, same name. This is now the transverse scapular artery and vein going to the other side. And again, the other side, you have this major vein coming up the arm. That's called the cephalic. We have a cephalic and a basalic. Okay. Those are our major veins of the arm. As you come up here, again, you'll see this is an area what's not the second. All you do is, I just remove the connective tissue over the top. Just kind of erase it. And look for the junctures. So just like that. So you're going to have one that goes continuous straight, one that goes back here towards the parotid, and one that cuts across. Now this one we probably have already cut once. Okay. But these are all branches of that of the external jugular. So we have the posterior and anterior see your book calls it, I'm thinking of the human terms, facial, okay, I think that's what your book calls it. The posterior and anterior facial. My problem is I teach comparative anatomy too, and it's a different set of terms, okay? So, posterior and anterior facial. I think your book sometimes calls this the transverse facial. Some books call it the transverse jugular. Doesn't really matter which. Okay, it's the one that cuts across. All right, and that's pretty much all the veins up top. I don't think you have anything else there except that. Now we go below the diaphragm, and again, just roll the stomach, leave the diaphragm down there. We can cut through the diaphragm so you can see the aorta come through. This is now the abdominal aorta. There's our kidney in the background. And there's our inferior vena cava, which we can also see right here as it comes out of the heart. That big vein right there that's going down. Okay. You pull up on all the organs like this, and you'll see an artery that comes straight up, another one comes straight up, and there should be one more. This one's broken. There's a little stump of it right here because it was so tiny. Okay, there's 3 that come up to the organs, and that's the way it is in a human too. We have the celiac, that begins with a C. Okay, then we have superior mesenteric. And then this tiny one, which goes directly to the colon, is the inferior mesenteric. So those 3 are always present. Okay, we're not doing the branches in the cat of the celiac. I don't think those are listed for you to do. I hope not. Okay, I'm going to skip them. The superior mesenteric pretty much goes to the small intestine, and when you hold up the mesentery, every artery and vein you see there is intestinal artery and vein. Okay, that's kind of easy. Okay. Same thing is true down here. When this comes over, all these arteries and veins that are actually on the colon are called hemorrhoidal. I'm not sure that's on your list or not. Okay. As you go back to the back body wall, then we have this one that cuts across. You see the arteries underneath it. That's the adrenal lumbar. We have the renal artery and vein. And we should have, and again, I only see the vein of the artery right here on the back body wall. See that one that's on the back body wall? That's the iliolumbar, running on top of the ilium. There should be another one right there. The other one you'll find this cat definitely does not have on either side. Well, he has a little remnant here and there, but again, his is so small because he's such a small cat. You would see a vein coming off right here would go down towards the genitals, so go over here to the ovary. So if you see these string ones that are leading over to the gonads, those are the gonadal or genital arteries and veins. Or if you want to be real specific, if it's male, it's testicular. If it's female, it's ovarian. Okay. As you come down here to the forks in the road, okay, the artery splits twice. Okay, gives off the external iliac on top and the internal iliac that continues down into the pelvic canal. In a human, that's not the way it happens. Okay, it happens as a single branch, then branches again, which is what this vein is doing in the background. It comes off as the common iliac, and then descends as the internal iliac and continues on as the external iliac. The iliac penetrates the body wall. We have the femoral artery, vein, and nerve right here, okay, all in that one spot. The nerve is underneath here. It's a little white structure I'm pulling up on now. Okay, continues down the inside of the leg on just beneath the surface of the saphenous, and continues deep to the deep popliteal. Okay, the popliteal artery and vein continue down below the knee, and they would split into the tibials, but we didn't go that far. Okay. The other artery that goes straight on through, like it's a continuation of the aorta, is the sacral. I think your book lists it as the caudal. It's not quite caudal yet because it's not out the tail yet, but that's where it's heading. It's heading out to the tail. The only other thing that's left is the hepatic portal, which this guy has a very sick one. I have to find my cat. My cat has a beautiful one, nice and big. Okay, this is going to be hard to see because this is not dyed. I'm trying to find the triply injected cat we have in there someplace that's injected with yellow. So if you see a yellow dye, you're looking at the hepatic portal system. Okay, and the only thing it has, you have a major branch that goes up towards the liver. That's this thing that's big right here, that brown thing that I'm shaking right there. That's the hepatic portal vein. It branches right here, going out along the pancreas towards the spleen. That's the splenic. And it continues on to the intestine, bless you, as the superior mesenteric. And it's going to link up with the artery of the same name. There it is right there. Okay. The only other thing to do is just kind of, if you just push the pancreas around a little bit, you'll see these big arteries and veins that are right here between the pancreas and the duodenum. Those are all pancreatic duodenal. There's 4 of them. Okay, so we just call them pancreatic duodenal. And if this were intact all the way, I should be able to find a small branch, like, oh, that might be it right there. A small branch of the veins going over to the large intestine, and that'd be the inferior mesenteric. But again, I'd wait until I find that yellow one. That's a lot easier to follow. Okay. And I think that's it as far as the cat goes. Okay. So you have a lot of models to work with.